Sickle cell disease is a serious, inherited blood disorder that affects millions of people around the world. It is caused by a mutation in the gene responsible for producing hemoglobin, the protein in red blood cells that carries oxygen. This genetic change is passed down from parents to their children, making sickle cell disease a lifelong condition that begins at birth. The impact of this disease is profound, not only on the individuals who live with it, but also on their families, communities, and healthcare systems globally. In a healthy person, red blood cells are round, soft, and flexible, resembling tiny donuts without holes. Their unique shape allows them to move easily through even the smallest blood vessels, delivering oxygen efficiently to every part of the body. These cells are constantly circulating, ensuring that our organs and tissues receive the oxygen they need to function properly. As these healthy red blood cells travel through the bloodstream, they pick up oxygen from the lungs and transport it to the heart, brain, muscles, and all other organs. This process is essential for life, as oxygen is needed for every cell in the body to produce energy and stay healthy. However, in sickle cell disease, the genetic mutation causes red blood cells to become stiff and shaped like crescents or sickles, rather than round. These sickle-shaped cells are not flexible and can get stuck together, blocking the flow of blood in small vessels. This blockage prevents oxygen from reaching vital organs and tissues, leading to a range of serious health problems. One of the most common and painful complications is known as a pain crisis, or vaso-occlusive crisis. During these episodes, the blocked blood flow causes intense pain, often in the bones, joints, chest, or abdomen. These pain crises can last for hours or even days, and may require hospitalization and strong pain medications. Over time, repeated blockages can cause permanent damage to organs such as the liver, kidneys, lungs, and heart. Sickle cell disease also increases the risk of life-threatening complications. Children and adults with the condition are more likely to suffer from strokes, which can cause lasting brain damage. Vision problems may develop if the blood vessels in the eyes become blocked. The spleen, an organ that helps fight infections, can become damaged or stop working, making people with sickle cell disease more vulnerable to serious infections. Another major challenge is chronic anemia. Because sickle-shaped cells break apart more easily than normal red blood cells, people with sickle cell disease often have fewer healthy red blood cells in their bodies. This leads to persistent fatigue, weakness, and shortness of breath, making it difficult to keep up with daily activities, attend school, or work. Sickle cell disease is a global health challenge, affecting millions of people worldwide. It is most common among individuals with ancestry from sub-Saharan Africa, but it also affects people from South America, the Middle East, India, and Mediterranean countries. In some regions, as many as 1 in every 365 children is born with the disease. The burden of sickle cell disease is especially high in areas where access to healthcare, early diagnosis, and treatment options are limited. Interestingly, the sickle cell gene has persisted in certain populations because carrying just one copy of the gene, known as sickle cell trait, offers some protection against malaria, a deadly disease spread by mosquitoes. This evolutionary advantage helped the gene survive in regions where malaria is common. However, when a child inherits 2 copies of the sickle cell gene, one from each parent, they develop sickle cell disease. Sickle cell disease is inherited in an autosomal recessive pattern, meaning both parents must carry the gene for their child to be affected. If both parents have the trait, there is a 1 in 4 chance with each pregnancy that their child will have sickle cell disease. This makes genetic counseling and testing important for families at risk. Unfortunately, many people living with sickle cell disease reside in low-resource settings, where healthcare facilities are scarce and specialized treatment is often unavailable. This can lead to delayed diagnosis, inadequate pain management, and higher rates of complications and early death. Access to basic interventions such as antibiotics, vaccines, and blood transfusions can make a significant difference, but these are not always available. Sickle cell disease remains a pressing global health issue that demands greater awareness, research, and resources. By improving access to care, supporting affected families, and investing in new treatments and cures, we can help millions of people live longer, healthier lives and reduce the burden of this challenging disease worldwide. Every year, on June 19th, people around the world come together to observe World Sickle Cell Awareness Day. This important day is dedicated to raising awareness about sickle cell disease, a genetic blood disorder that affects millions of people globally, yet often remains misunderstood or overlooked. By marking this date on our calendars, we acknowledge the ongoing struggles faced by individuals and families living with sickle cell disease, and we commit to learning more about their experiences. Sickle cell disease is a serious health issue that impacts not only the physical well-being of those affected, but also their emotional and social lives. Families and communities often face challenges such as frequent hospital visits, chronic pain, and limited access to specialized care. The day serves as a reminder that behind every statistic is a real person, a family, and a story of resilience. Recognizing the urgent need for global action, the United Nations officially established World Sickle Cell Awareness Day in 2008. Their goal was to shine a spotlight on this condition, increase public knowledge, and encourage support for those affected. Since then, the day has become a rallying point for communities, healthcare professionals, and advocates worldwide to join forces and make a difference. Education is at the heart of World Sickle Cell Awareness Day. Schools, organizations, and advocacy groups use this opportunity to teach people about the causes, symptoms, and treatments of sickle cell disease. By spreading accurate information, we can dispel myths, reduce fear, and foster empathy. Advocacy efforts also play a crucial role, as they amplify the voices of those living with the disease and push for meaningful change. Across the globe, events and campaigns are organized to demystify sickle cell disease and combat the stigma that often surrounds it. Community gatherings, health fairs, and social media campaigns help to bring people together, share personal stories, and encourage open conversations. These activities not only raise awareness, but also build a sense of solidarity and hope. World Sickle Cell Awareness Day also highlights the urgent need for better healthcare systems and improved access to treatment. Many people living with sickle cell disease face barriers to quality care, including lack of resources, limited medical expertise, and high treatment costs. By drawing attention to these challenges, the day inspires action from governments, healthcare providers, and communities to work towards solutions that ensure everyone receives the care they deserve. Ultimately, World Sickle Cell Awareness Day is about uniting our voices to create lasting change. By advocating for better policies, supporting research, and standing in solidarity with those affected, we can help improve lives and ensure that everyone, no matter where they live, has access to quality medical care and support. Together, we can make a difference. One voice, one action, and one day at a time. World Sickle Cell Awareness Day spreads crucial knowledge about the disease. Understanding its inheritance, symptoms, and impact helps families make informed health decisions. The day combats stigma by challenging misconceptions and promoting empathy. It highlights gaps in medical services and calls for better training and access to treatments. Awareness encourages research for better therapies and a potential cure. By focusing global attention, we advocate for comprehensive care and medical innovation. The journey to establish World Sickle Cell Awareness Day is a story of perseverance, hope, and the power of collective action. For decades, sickle cell disease was a condition that received little attention on the global stage, despite affecting millions of people worldwide. Families, patients, and healthcare professionals faced not only the daily challenges of the disease itself, but also the struggle to have their voices heard and their needs recognized by the broader medical community and policymakers. Patient advocates, families, and medical experts from around the world came together, determined to shine a light on this neglected health issue. They organized awareness campaigns, held conferences, and lobbied governments and international organizations. Their tireless efforts were driven by a shared belief that everyone affected by sickle cell disease deserves better care, more research, and greater understanding. In 2008, after years of advocacy, the United Nations General Assembly adopted a landmark resolution. This resolution officially recognized sickle cell disease as a global public health priority, acknowledging the urgent need for international cooperation, improved care, and increased awareness. It was a historic moment, marking the first time the world's leaders united to address the challenges faced by those living with sickle cell disease. June 19th was chosen as World Sickle Cell Awareness Day to honor Dr. Walter Clement Noel, a pioneering figure whose case was first described in 1910. Dr. Noel's story became a symbol of the long journey toward understanding and treating sickle cell disease. By selecting this date, the world pays tribute not only to Dr. Noel, but also to the countless individuals and families who have faced this disease with courage and resilience. The first official observance in 2009 marked a new era of global solidarity. Communities across continents joined together, hosting events, sharing stories, and raising awareness. This day became a rallying point for advocates, patients, and supporters everywhere, uniting their efforts to improve the lives of those affected by sickle cell disease. Over the years, World Sickle Cell Awareness Day has grown into a powerful movement. It has sparked important conversations, inspired new research, and led to improvements in care and support for patients worldwide. Today, it stands as a testament to what can be achieved when people come together to demand change, spread hope, and build a brighter future for all those living with sickle cell disease. Sickle cell disease presents lifelong health challenges, including severe pain and chronic anemia. It can lead to organ damage and life-threatening complications. Socially, patients face stigma and misunderstanding, impacting mental health and daily life. Global healthcare inequalities exacerbate these challenges, especially in low-income regions. Limited access to diagnosis and treatment means many suffer unnecessarily. The economic burden is immense, straining families and healthcare systems. More cost-effective treatments and preventative strategies are urgently needed. Early diagnosis through newborn screening is crucial for managing sickle cell disease. It allows for preventative treatments that can avert serious complications. Awareness campaigns educate parents about genetic risks and the importance of screening. Informed patients and families can better manage the condition and improve outcomes. Early intervention and education are foundational to effective healthcare and quality of life. Medical research is offering new hope for sickle cell disease. New drugs and therapies are reducing pain crises and improving quality of life. Gene therapy, a promising area, aims to correct the genetic cause of the disease. Clinical trials show remarkable results, with some patients effectively cured. Researchers are working to make these treatments accessible and affordable globally. Continued advocacy and investment in research are paving the way for a brighter future. Advances in medicine and global commitment are transforming sickle cell care. Personalized treatment and new medicines are improving patient outcomes. Global cooperation is leading to better funding and healthcare programs. Universal newborn screening and comprehensive care centers are becoming priorities. Increased awareness is reducing stigma and fostering a supportive environment. The ultimate goal remains a universal cure, driving ongoing research and innovation. The fight against sickle cell disease is ongoing, requiring resilience and hope. World Sickle Cell Awareness Day calls for action and community support. Raising awareness and combating stigma are crucial steps forward. Advocacy for better healthcare and research funding is essential. Equitable access to care must be ensured for all, regardless of location. Together, we can build a future where sickle cell disease is no longer a life-threatening condition.